Hello, my name is Susannah Morris and I'm a health consumer advocate and representative working with various health consumer organisations, governments, policymakers, clinicians and researchers in Australia and overseas. I'd like to share how I came to value a person-centred, value-based healthcare approach as a way to improve experiences and outcomes for people, and why I think that health consumer organisations and consumer advocates and representatives should join us in Melbourne in September. For me, it all started as a consumer of healthcare, both as a parent of children with chronic health conditions and as someone diagnosed with cancer. Although we all had experiences of good standards of care, that care didn't seem to be organised around us. Instead, it was organised around health providers and the structures and systems that made sense to them. Many were not as lucky as us and were not getting good quality care they needed either. So, like many people who work for health consumer organisations or become advocates, I wanted to try and see whether my experience and my voice could help improve healthcare for others. Now, listening to other people, time and again, I heard people felt it was hard to get the right care in the right place at the right time. I was also hearing clinicians and policymakers all talking about the importance of delivering person-centred care. So why did people not feel that healthcare was person-centred? Largely because not enough account was taken of the experiences and outcomes of value to the people affected by various health conditions. Nor was it sufficiently recognised that people's needs and values may differ. Most of us on the consumer and the provider side do share a common goal to live well and want health systems to provide the best experiences and outcomes they can. But at the same time, we know those systems are constrained by available resources, and those resources need to be allocated equitably. Healthcare providers are under constant pressure to look for value in what they do. But that value does not mean providing the maximum quantity for the lowest possible price. It's no good providing things if they don't deliver positive experiences and outcomes for the people for whom healthcare exists, and that's where we need to look for value. Person-centred, value-based healthcare for me is the framework in which we can all come together to make our health systems the best they can be by looking at what's of value to the people they exist for and thinking about how do we deliver that in a sustainable way. So if you're a health consumer leader, sign up to join the health consumers who've already registered to be part of the multi-stakeholder conversation to consider how we can design, implement and evaluate person-centred, value-based healthcare. Come and join us to work alongside other stakeholders to shape the person-centred, sustainable future, healthcare of the future. I hope to see you there.